Hi, I'm Jane Sayer. I'm the Director of Nursing and Quality at Norfolk and Suffolk NHS Foundation Trust, and we're a trust that serves the populations of Norfolk and Suffolk for their mental health needs, and we also provide addiction services in Norfolk. Our workforce challenges are mainly around the availability of Band 5 and Band 6 nurses. As an organisation that covers 2 counties with a huge geography, we require people who are flexible, who are able to move, and we're also surrounded by sea. So the opportunities to bring people in from outside the organisation are not great. Therefore, it's really important that we support the people that train with us to stay with us. We're really happy to be part of the Good Practice Guide and to contribute to it. For us, I think it means that we're part of a network or a community that's trying to solve the same problems that everybody has in their organisations. And rather than each organisation trying to tackle that individually, it means that we can talk to other organisations about the good work that they have done rather than reinvent the wheel every time. So our particular case study focuses very much on recruitment and recruitment of our student nurses. I worked for a long time in London where we really struggled to recruit everybody we trained, not because we didn't have the posts, but because the quality of the candidates coming through didn't meet the standards we'd set. And in my heart, I had always wanted to recruit everybody that we train. I think it's a real shame to waste potential. And also as an organisation, we have a responsibility to make sure that everybody that comes on placement with us is fit to practice at the end of their training. So our work has largely been about ensuring that our mentors are competent to sign off people as they go through their training, identify problems early so that we can work with universities to make sure that people fix those, and that our sign-off mentors in particular are really confident about signing off people as fit to go onto the register and fit to come into employment with us. And I feel sufficiently sure that that is the case, that a year ago we guaranteed employment to everybody that trains with us as a registered nurse. We've passed that message on to our student nurses. We still put them through an application process, and I think this is important because otherwise those students wouldn't get a chance to try out the process of application, to sell themselves and their skills in a formal way. And we also interview them. So we don't interview them for a job, we interview them to try to match their skills, experience and interest to the best clinical area. And we also use it as a diagnostic to see where perhaps we need to provide more input post-qualification. What we can't have is every student chasing one job. That just wouldn't work for us. So we need to make sure that students are matched to the right opportunity, but also that it fits the needs of the organisation. So we have a process by which we try to make sure that people get their first choice of job. If they don't, it'll be their second choice, and we'll look at options for them moving, perhaps when they've consolidated their learning once they've been in post. Often though, what we find is people go to their second choice of employment and absolutely love it and don't want to move. We recognise that the point of qualification is quite a scary moment for nurses. So a couple of years ago we set up what we call our newly qualified nursing academy, and we invited all our newly qualified nurses to meet together once a month. In that process, they do all their mandatory training together. They have guest speakers that they can choose if they have a particular topic that they want to know more about, and they have an action learning set. So we very much were treating them as a cohort of people, continuing that support they'd got as students through into that first year of registration. The feedback from that has been phenomenal, and what we've seen is those newly qualified nurses stay with us, stay with the organisation. So we've expanded it more recently, opening it up to all professions, and now people can step on and step off at any point. We encourage people to stay on the programme for a year, but if that doesn't work for them, then that they come back when they're ready to. And again, fantastic feedback on that. I think in the future what we'd like to do is formalise that feedback a little bit more and marry it up with the statistics around people leaving the organisation to make sure that actually it does support people to be the practitioners they want to be once they've qualified, and to look a little bit more about whether we're meeting learning outcomes. In terms of learning from the approach we've taken, certainly we've made some decisions that we've had to rethink. So initially we said that anybody qualifying as a newly qualified nurse would have to work in an inpatient area. And we did that both because we had a lot of vacancies there, and also we thought people would get better support and it would suit their learning needs. What we found is for most people that is true, but for some people they have experience prior to their nurse training, often in community settings, and that's their preference, naturally that they flourish there. So we've had to rethink that approach, and on a case-by-case basis we will make a decision about somebody actually starting their career in the community, if that's right for them and right for the organisation. So I think to take this step is quite a brave one. You have to be absolutely confident in the ability of your mentors to help students develop to be the best that they can be, but also to raise concerns when those concerns are valid, and to talk to the universities about stopping placements if required, or stepping people back a placement or two. So the confidence has to be in the mentors and their role and their processes, but also in the university's recognition that sometimes we have problems that we need to resolve together. What I don't want to do is get to the final sign-off placement and then the student to fail. If that happens, we have failed the student in the 3 years of their training, and that's absolutely not where we want to be. So in terms of where we take this approach next, I think we need to continue to evaluate the outcomes of the academy. We've done some informal evaluation through seeing people's thoughts about the approach, what they've got out of it. What we haven't done is any hard and fast evaluation of whether it helps people to stay in the organisation, how it really helps people to embed and develop their practice. The other thing that's come through from feedback from those people that are their preceptors out in practice is, well, what about us? And particularly I think for people that have gone away through their career and are not quite sure of the next step, they would like some input in a similar kind of way. So we're now talking about developing a mid-career academy, again open to all, largely focused I think on helping people to think about where they take the rest of their careers and how they would get the right support to develop. In terms of the benefits of this, we see that we recruit over 90% of the students from both our universities. And those that don't come and stay with us, it's usually because they haven't necessarily come from the local area and want to return to where they came from. So I think I'm really proud of that. I think it would be great if we could get to 100%, and we're always talking to our students about what more we could do to make us an attractive employer. It fits into our organisational workforce development strategy in particular, and really supports the idea that we want people to come from our local populations, we want them to train with us, and then we want them to stay with us. We know, although we welcome anybody at any time, that those people that come from us locally have a real commitment to the organisation, and we want to celebrate that and support that.